It's one of the world's most polluted cities, India's capital, Delhi. Cooler temperatures there are trapping pollution in thick layers of smog. Well, that means millions of people are breathing this in day after day. Pressure is on the government to act. India's Supreme Court has weighed in, saying the pollution is causing the complete murder of our young people.
This girl has asthma. Doctors say the culprit is pollution in the air. She now struggles to breathe. The treatment is likely to be expensive. Dr. Sana Salim is responsible for hundreds of patients with respiratory problems. This ward is full.
This week we've had more of respiratory cases. And especially this is really dangerous to newborns, first of all, and secondly to malnourished children. I definitely feel this is a sort of a medical emergency and we need to intervene, now than never.
Hospitals here in the capital say they have seen patient numbers double this week. It's the time of the year when Delhi's air becomes toxic. Pollution tends to increase with the onset of winter. Much of the pollution comes from within the city, from cars. But this is also a significant factor. Farmers outside Delhi burning the straw rubble that remains after harvesting. The city government is trying to protect people by keeping them inside. Construction has been stopped and schools closed. New rules have also banned these. But even a Supreme Court ruling could not stop people from setting off crackers during the Hindu festival of Diwali.
Yes, I agree that it adds on the pollution part because of bursting crackers, but this is something which cannot be avoided. This is part of ritual. We have been celebrating this since ages, so we cannot avoid because a lot of things are adding to the pollution. This is not the only factor.
And this is what Delhi looks like a day after Diwali. Pollution levels are several times higher than the safe limit. People living here have no option to escape the air pollution by staying indoors. These children work mostly as waste pickers. A desperate community that keeps Delhi clean is the most vulnerable to the toxic air. Today, a team from an NGO called Chetna visits the slum to teach children about air pollution and hand out masks to protect them.
The children living here are in a very difficult, in a very challenging condition. So the objective is to protect them in their community. Like we all can see that they are not from the background who can afford air purifiers or machines like this, which can, provide them a healthy environment in their homes.
Health experts say that until the government and the citizens treat air pollution as an emergency, millions will continue to damage their health just by breathing.
Journalist and clean air activist Jyoti Pandey-Lavakari is in Delhi. She wrote the book Breathing Here is Injurious to Your Health, The Human Cost of Air Pollution and How You Can Be the Change. Welcome to DW News Asia. We've just seen in that report how bad air pollution is in Delhi. Could you spell out for us how does this affect how people go about their day-to-day lives?
Well, if you're among the minority of people who are very aware of the health harm that air pollution can trigger, then you're in a state of almost a self-imposed lockdown because you can't step out of the house without the mental anxiety of knowing that this air pollution, this toxic air that you're breathing is actually causing inflammatory distress and oxidative stress in your body, which is not just going to cause short-term health harm, but longer-term health harm like cancers and cardiovascular harm. But apart from that, just the immediate effect of being outside makes your eyes sting, your throat kind of is always scratchy. There's hardly any sun in the middle of the day. Today, I had to put on lights because it's like a dark shroud has completely enveloped the city. And it is just very hard. You get a headache. You just physically, you're reminded all the time that the air that you're breathing is so deadly.
Look, in your book, you write that breathing has become the new smoking. Of course, most people do understand the risks associated with smoking. How aware, though, are people generally about the dangers of air pollution?
Not enough, unfortunately. Of course, there's a small cohort of people, a lot of the public health experts and some doctors who are aware of the severe and long-term and irreversible health harm that air pollution causes. But unfortunately, the larger mass of people are not so aware. And even if they are aware, they're not aware of the specific and exact nature in which air pollution can trigger disease, disability, and death. So I would say that there needs to be much more mass awareness of the severity of health harm that air pollution can cause before there is going to be any change in policy or any change in the government's ability to bring down air pollution in the country.
Jyoti, this is personal for you too, because your own mother had an unexpected lung cancer diagnosis linked to polluted air and very sadly died, and I'm sorry for your loss. I want to ask you, what does the research show us about how common cases like your mother's are?
So research is beginning to show us more and more that there are more and more non-smokers, younger and younger population, and more women who are non-smokers who are getting lung cancer. And unfortunately, because lung cancer does not immediately throw up symptoms, it is being diagnosed at a later and later stage. In my mother's case, it was diagnosed in the terminal stage, and she barely had any symptoms, but she died within 3 months of the diagnosis. And unfortunately, that is what we are seeing more and more of. There are several cases of lung cancer and many other cancers that are triggered by air pollution. And unfortunately, I don't think that exact connection of dots is happening amongst in the minds of the general people. And unfortunately, also the public awareness of such health harm is not being made with enough focus in the public domain.
Jyoti, we've got about a minute left. Who's responsible for all this, and are they being held accountable?
Unfortunately not. They are not being held accountable, and it is mostly, I would say, we are all complicit and implicated in this, but it is up to the government and the leaders of the country who have, in a democracy, they are the ones who are supposed to lead the change. And the government has failed in this task of bringing emissions down, which is the only way to reduce air pollution. And the industry is also equally responsible. So the corporates and the government together are the most responsible for this deadly air pollution that is shrouding the country. People can make a difference and can try, but in a population of 1.5 over 1.4 billion people in this country, I think each one can make a small difference, but the biggest difference can only be made by the government and the corporates, and they are the ones who are responsible and accountable. And unfortunately, we are not enough aware to hold them accountable, because transparency precedes accountability, and there is not enough transparency in this area because of lack of awareness in air pollution.
Yes. Jyoti Pandey-Lavakadi in Delhi, thank you so much for your time.
Thank you. Thank you for having me.